Welcome to DentiMax. In this video, we're going to go over some new Perio display options in the periodontal charting screen. To begin, I'm going to select my patient Fred Flintstone here from the scheduler and open up the patient's chart screen. On the chart screen, I want to point out a couple items that he has of interest. First of all, he has an existing implant and implant crown on tooth number 28. He has an impacted tooth on number 17, and he still has a retained primary tooth on number 12, or I in this case. So when we go over to a new perio exam, there's a few options on how the system will treat those items. Specifically, number 28 now shows an implant where an implant exists as an existing restoration or a completed treatment item that you've done yourself. For primary teeth, it will show the primary tooth now and the primary tooth number instead of the traditional adult tooth. And where the impacted tooth is, you have the option on whether or not you want that tooth to be displayed in order to probe it, or if you want to hide it on the perio chart because it's not able to be probed, depending on the situation. You can check out the condition codes for the impacted teeth, which I'll jump over to now. So there's an impacted mesial and impacted distal condition code. You can create additional condition codes for impacted and not surfacing or impacted and surfacing, and decide how you would like to treat the drawings on each of those individual codes. But if I edit this code and go to the charting section, I do have this little option here to hide the tooth on the perio exam when I've used this code specifically, and so that is how that code is acting in my perio exam. You do also have the option now to mark bleeding points after you've done the probing, or if you leave that unchecked, it'll default to be before you've done the probing, as it has been in the past versions of the software. If you have any additional questions about those new perio display options, please contact our training department at 1-800-704-8494 or email training@dentimax.com. Thank you.